So, a second common myth about spine pain is that spine pain has a tendency to become persistent and worse with age. And we know through the research that most episodes of spine pain has a relatively good prognosis, meaning that it begins to resolve relatively quickly, even though it may linger and take a while to completely go away. You're able to resume normal activities of daily living and normal function pretty quickly. And the good news is, we actually know that a small percentage of cases go on to become chronic and persistent. And that's around 5 to 7% of the cases. And the good thing also is that we know what factors make someone susceptible or at risk for developing a chronic back condition. And part of the goal that we do in our office is to screen for those risk factors. And as soon as you come into the office, if we see any of those risk factors, we address them to prevent chronicity or to prevent this episode from lasting longer than it should. And we know that as we age, the incidence of low back pain actually decreases. So a common myth is that as you get older and you get more arthritis or more bone spurs, that you're more likely to have back pain. We hear this every day from patients or friends. And that's just simply not true. The incidence of back pain peaks around 40 to 50 years old, and then as we get older, we're less likely to have back pain. So please share these myths and the facts or the corrections to those myths with people you know. Share this video, because again, by perpetuating these myths of spine pain, things that have been passed on from practitioner to practitioner or patient to patient, oftentimes what the research shows is that it leads to unnecessary surgeries, unnecessary injections, just a disabling form of thinking that actually could perpetuate your pain, and even to unnecessary lengthy visits to physical therapists or chiropractors, when most cases of back or neck pain should be managed relatively simple with simple advice on how to manage the condition. Because in the research, what spine pain has been likened to, specifically back pain, is like a common cold. It has a tendency to flare up and then get better with time with natural and simple self-help solutions. Again, just like a cold. So stay tuned for future myths, again, regarding the episode or the article from Peter O'Sullivan in the British Journal of Sports Medicine.